Glass fairies and bone children. Adolescents and young adults with anorexia nervosa show positive reactions towards extremely emaciated body pictures measured by the startle reflex paradigm. By Rochelle et al.
Anorexia can be described as a pattern of self-starvation resulting in extreme weight loss. This is fueled by an exaggerated drive to meet the mass media's propagated general thin ideal, and an obsessive fear of gaining weight. The website ProAna has galleries that act as motivators for young women to lose weight. They show pictures that do not reflect what is average for a woman. This study has a total of 8 hypotheses. To summarize, they expect a decrease of the SAM scores and startle reflex magnitude in both groups. The arousal hypotheses can be reduced to that they expect a change in physiological arousal for pleasant and unpleasant cues in both groups. They also expect a change in the SAM scores when viewing emaciated body images in both groups. They had 36 participants in the anorexia group and 36 participants in the control group, with both groups were matched for age and education. Their age ranged from 14 to 21. They excluded participants that had impairments to vision, also for neurological diseases and hearing. The researchers started with 8,000 pictures. They reduced the amount of pictures to 36 by getting rid of those with poor quality or if they didn't show things such as projecting ribs, hip, cheek, or collarbones. These photos were standardized for background and emotional expression. Also, to protect the person's identity, the researchers did not show any faces and modified distinctive features with Photoshop software.
The participants were seated in front of the screen and prepared for the psychophysiological measurements. 4 landscape pictures with 3 startle-eliciting noises were used as an introduction to reduce habituation effects. 52 stimuli were then presented in 2 counterbalanced sets of 26 images. Each image was shown to the participants for 12 seconds each. 3/4 of the pictures of each stimulus category, unpleasant, pleasant, and neutral, had a startle-eliciting noise along with it. There was a break of 15 minutes in between each set. After the removal of the electrodes, half the pictures were shown again. This time, the participants rated each image for valence and arousal on the SAM scores. Participants filled out questionnaires concerning body image, eating behavior, and general emotional functioning. Startle reflex response, eye blink, was measured using electromyographic activity, EMG. The magnitude was defined as the difference between peak EMG and baseline reflex shape. Skin conductance response was recorded by column-borne isolated skin conductance Coupler V7123. The magnitude was defined as the difference between peak SCR level within the 900 millisecond to 4000 millisecond time interval after picture and baseline. The heart rate response was recorded by electrocardiographic activity, ECG. The overall HR change was defined as the difference between the mean HR and the baseline. The HR acceleration was defined as the difference between HR maximum and baseline, and the HR deceleration was defined as the difference between baseline and HR minimum. For subjective ratings, participants filled out the self-report SAM scales of Bradley and Lang, 1994. The participants rated each image on the scale valence, ranging from 1, unpleasant, to 9, pleasant, and arousal, ranging from 1, low arousal, to 9, high arousal. Using IBM SPSS Statistics 19, the researchers used univariate variance analyses, ANOVAs, to compare the anorexia nervosa patients to the healthy controls. The main effects for group and interaction effects were compared. The researchers found a lot of significant results. Overall, the anorexia nervosa patients received a significantly lower BMI and scored higher on the eating disorder inventory. For Hypothesis 1, the startle reflex magnitude was significantly higher for unpleasant pictures than for neutral pictures. It was also significantly higher for neutral pictures than for pleasant pictures. For Hypothesis 2, SAM scores were significantly higher for unpleasant pictures than for neutral pictures. For Hypothesis 3, the startle reflex response elicited during the viewing of emaciated bodies was significantly smaller than that elicited during the viewing of the neutral and unpleasant pictures. For the control group, they had significantly larger startle reflex response for the neutral and pleasant pictures, but not as large as the AN participants for the unpleasant cues. For hypothesis 4, the body pictures scored significantly higher and were rated significantly more negatively than neutral pictures in both groups. For hypothesis 5, no main effect was found for SCR scores for pleasant, unpleasant, and neutral pictures. However, there was a main effect for overall heart rate. There was a significantly stronger decrease for unpleasant pictures than for pleasant and neutral pictures. For hypothesis 6, self-reported arousal for the pleasant and unpleasant pictures were significantly enlarged compared to the neutral cues. For hypothesis 7, SCR elicited by emaciated body images was significantly larger than that elicited by neutral cues in both groups. And finally, for hypothesis 8, SAM arousal scores showed a significantly increase of self-reported arousal for emaciated body cues compared to neutral cues.
Patients with anorexia nervosa self-reported significantly higher rates of arousal and body dissatisfaction and a significantly worse mood than participants in the control group before testing. However, there were no significant differences in hunger. An ANACOVA was run and found that none of these factors influenced the results. By using pictures of people with projecting ribs, hips, and cheekbones, and sunken cheeks and abdomens, the study successfully displayed images with body cues that were aversive to healthy people. This was backed up by the fact that the control group and patients with anorexia nervosa processed the images differently. When testing the valence hypotheses, it was found that the control group showed a significant startle potentiation when they were shown the emaciated bodies. However, a single startle inhibition was found in patients with anorexia nervosa when they viewed both the healthy and emaciated bodies. This demonstrated that the emaciated bodies were appealing to people with anorexia, which is contrary to the research in the area of anorexia and in line with research in the area of addiction. It is the first study to find evidence of automatic appetitive reactions on addiction-specific stimuli in anorexia. Despite the physiological reactions recorded, both groups were self-reported aversive responses to the emaciated pictures. This may be because patients were unaware of their appetitive reactions to the emaciated pictures, or because they were unwilling to express them openly due to a fear of social stigmatization. When testing the arousal hypothesis, there was no significant comparison found between neutral and pleasant pictures aside from the SAM valence score. This could have been because of the stimulus choice. The subjects in this study were children, so pictures that typically produce the highest arousal could not be used due to child protections. Another reason significance may not have been found was because skin conductance response was scored between 0.9 and 4 seconds after the picture was shown. However, the peak of skin conductance response is 0.5 to 5 seconds. The findings of this study challenge the fear of weight gain theory, which suggests that starving is primarily a way to reduce the fear of becoming fat, while supporting the drive for thinness theory, which suggests that starving is a way of meeting a desired body ideal. The results of this study suggest that there should be a measure for treatment effects and a measure of effects of exposure therapy beyond self-report, as this may not always be accurate. In addition, they suggest that therapy for anorexia nervosa should not only focus on the fear of gaining weight and negative learning experiences or role models, but also on what benefits a patient can gain from starving and positive role models that may have reinforced starvation, such as pro-ANA forums. The limitation in the study is that it cannot generalize to older populations as it was done with children. In addition, it lacked a comparison group of girls who were underweight but did not have an eating disorder. Also, all of the patients in the experimental group had contact with other patients who had anorexia, which may have created habituation to emaciated bodies. There were also weaknesses in the study design, such as the fact that there were an unbalanced number of pictures shown from the different categories. In addition, a cross-sectional experimental design was used, which limited the ecological validity of the setting. In the future, research should focus on investigating emotional reactions to emaciated body pictures in anorexia using the startle reflex paradigm, with pictures taken from pro-ANA forums. It also may focus on figuring out how unhealthy views of body weight develop, such as answering the question, is it precondition or result of the disorder? Finally, research can work on influencing the response patterns in people with anorexia to emaciated body images and the therapeutic conditions that are needed to do so.